and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday, we'll be providing a written statement with relevant information about the COVID-19 pandemic in BC, including case counts, around 3 o'clock each of those days in written statements. And then on Thursday, we'll be back here in the Press Gallery Theatre in Victoria. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we are reporting on the 3 periods over this past weekend. From Friday to Saturday, we had 881 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 847 new cases, and in the last 24 hours, 763 new cases of COVID-19. That brings our total to 2,491 new cases diagnosed in British Columbia, and our overall total to 126,249 people diagnosed with COVID-19 in British Columbia. Of the new cases, 466 were in the Vancouver Coastal Housing, 632 were in the Fraser Health Region, 82 were people who lived in Vancouver Island Health Region, 206 people lived in the Interior Health Region, 104 people in Northern Health, and 1 was a case in a person who normally resides outside of Canada. We currently have 8,199 active cases in all areas of the province, and 484 people are in hospital with COVID-19 right now, 158 of them in critical care or ICU. We have 12,340 people under active public health monitoring, again all over the province, and 116,241 are in the recovered range. We've had 1 new outbreak to report since our last reporting period at Orchard Haven in Interior Health. So that brings us to 8 active outbreaks in long-term care, assisted living or independent living, and 7 in acute care facilities. Over this past weekend, we've had 17 more people who've died from COVID-19 in British Columbia, bringing the total number of people to 1,571. As always, our condolences and our thoughts go out to families who have lost a loved one during this pandemic, and also to the care providers in the communities. Our thoughts are with you during this very difficult time. And I just want to give a little more detail about the people who died over this past weekend. One of them was a person who resided in one of our long-term care homes that had an outbreak. In addition, by age group, 2 of the people who passed away over the weekend were over the age of 90. 7 were in the 80 to 89-year-old age range. 5 were in the 70 to 79-year-old. 2 in the 60 to 69-year-old age range. And 1 person was in the 50 to 59-year age range. Again, this shows us how devastating this virus can be on people who are older. There has been some concerns expressed in other parts of the country about people who are dying at home from COVID-19, and that, of course, is a terrible tragedy. Here in British Columbia, any sudden unexpected death, as they're called, are investigated by the Coroner's office to understand the cause of death. And since the start of this pandemic in March of 2020, we have been working with the Coroner's office to establish a protocol that includes COVID-19 assessment for a potential infection with COVID-19 in all sudden unexpected death investigations across BC. As always, the coroner's investigation can take several weeks to months to complete, depending on the complexity of the situation. And should it be determined that COVID-19 was either a direct cause or one of the underlying factors in a death, the coroner has a process where the families are notified and the information is reported to public health in our COVID-19 data reporting. We've had several hundred deaths that have been investigated by the coroner's office since March of last year, and a very small number of them have been determined to be due to or related to COVID-19. Tragically, one of those was earlier this year in January, an infant died, an infant from the Interior Health Authority, was being treated at BC Children's Hospital and died. And the coroner's investigation, which concluded last week, determined that COVID-19 was indeed a factor in this infant's death. This is, of course, the youngest death that we have had, tragically, in our province from COVID-19. And I'm reporting this today as the report from the coroners will be included in our weekly surveillance report this week. The family has been notified, and Interior Health is working with them. And the privacy, of course, of the family is paramount, and we won't be adding any additional information, but just recognizing the tragedy of a young life lost. I'd also like to note, though, we have seen a spike in cases in the last few weeks. We have been working closely with the coroner's office, and we have not seen an increase in sudden unexpected deaths related to COVID, or even to be investigated as possibly related to COVID in the last few weeks, and we will continue to work with the coroner's office to monitor this. I will remind everybody that if you have COVID-19 and you're isolating at home, if you have any health concerns, you can call 811 to get support and advice. You can call 911 if you have shortness of breath or any other concerning symptoms and need care. And this goes for anybody with COVID or with other health conditions. Our hospitals are absolutely stretched right now, but our doctors and nurses and care staff are there to provide the service that people need. Our emergency departments are ready and active and safe for people to go, whether it's for COVID or for non-COVID related emergencies. To date, in our vaccine update, we've delivered 1,635,372 doses of the 3 COVID-19 vaccines across BC. 89,035 of those have been second doses. And I want to remind everybody that's over 18 right now that you're eligible to register in our program, in our system, for your vaccine, and that will make it the most efficient way to be notified as soon as your age category is eligible for booking of appointments. And we're now booking appointments for people in their 60s and into the high 50s in the next day. I'm also hearing that some people may be concerned that the information we're collecting to be able to record your immunization and make sure it gets into our provincial immunization registry is they're concerned about sharing of this personal health information while you get your vaccine. I can reassure you that that is not the case. Any information we gather is personal health information that is protected, and your privacy is protected, and it is not provided to any other agency or part of government. And I know this has been a concern for new Canadians, for people who are here visiting, and for people who are here on temporary visas, etc. Our goal from the very beginning has been to provide a safe and effective vaccine to everybody in British Columbia. Whether you are a citizen of BC or a normal resident of BC, whether you're a citizen of Canada or whether you're here, because we know that providing vaccine to everybody is what protects us all. And we have had a program from the very beginning to provide vaccines to our temporary farm workers, for example, recognizing the essential work that they do in our communities. And we provide it at the time when they're in the quarantine services that we as BC have provided to make sure that people are here and are safe before they go into our communities, and that they as an individual are protected as well as our community. We also have been providing immunization to rotational workers and others in the province, so do not be afraid that you are not eligible for vaccine or that your personal health information will be shared with any other government agency. It's important for all of us to get immunized when our turn comes up, and we can be proud when we get that and be happy when we get our vaccine. And I know there's been some concerns that people are afraid to share their pictures of themselves getting immunized, but this is an important time of hope for all of us, and everybody will have the opportunity to receive their first dose of vaccine in the next and the next 8 weeks within the next few months. So when we are immunized, we protect not just ourselves, but we protect our co-workers, we protect our families, the people we live with, and our communities. So all of us should celebrate every single vaccine dose that's given in our province, and I encourage everybody to step up when you're offered an immunization, when you have that appointment, to go ahead and get your vaccine too. Our goal, as we've talked about, is to prevent severe illness and death, and that's why we have focused from the beginning on those most likely to experience those, and that is by age. But we also know that some people's health condition makes them more at risk. And we know that it is some people as well who are who must go into work every day, who are exposed to others in the community that put them at increased risk, and we've targeted programs at those people as well. So we want to make sure that we stop severe illness and death, and the good news is that all 3 vaccines that we have available have been shown to do that and to be very effective at preventing people from being in hospital. And there's more data that came out of the UK that's been recently published that showed that both AstraZeneca and the Pfizer vaccine are highly effective at preventing people from needing hospital care. And that is important right now when we are seeing a burden on our hospital system and on our ICU system. So everybody who's offered a vaccine right now can be confident that it is protecting them and will protect our healthcare system. We also know that we talk about the concerns about community immunity, and it is very much protecting us from transmission, and it will be a time before we can get to that place where all of us can let our guard down a little bit. So even if you have been immunized now, it does take some time before that protective level comes, and that's 2 to 3 weeks. And in that time, we all, right now, need to continue to do those things that prevent our transmission of the virus from us to somebody else. We talk a lot, or we hear a lot of talk about variants as if they're some separate entity, and really the fact that a new strain arises and that we're able to detect it is more a testament to the laboratory systems we have now, particularly whole genome sequencing, that allows us to watch the natural mutation of viruses in real time and determine if there's specific mutations that give that strain of the virus a competitive advantage. But when we talk about variants, we are still talking about people who are infected with COVID-19. And it is the things that we do that prevent us from getting infected or passing it on to others that remain the same, no matter which strain of the virus we're infected with. COVID-19 is not about where the virus mutations come from, whether they were initially detected in India or in Brazil or the UK. It really is about the things that we do now, that we know how to do, that prevent transmission with whatever virus we have at the moment. And that means to stay local in our communities, to reduce the number of contacts we have, to always use our layers of protection, including wearing masks when we're in indoor public spaces, to make sure that we keep our safe distance from people, that we do things outside and at a distance, not inside as much as possible, and that we go and get our vaccine when it is our turn. We need to keep doing all of these things for the next few weeks until we can get everybody protected from COVID-19. And we need to remember that this time, when it is so challenging and there's so much potential, we need to remember to be kind to each other, to stay calm, even though it is challenging, and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I want to start by expressing my condolences to the 17 people who passed away over the last 3 days, linked to COVID-19 in British Columbia, 9 from Friday to Saturday, 5 from Saturday to Sunday, 3 from Sunday to today. That is obviously a huge loss in our communities. And I want to pass on my condolences in particular to families, to friends, to caregivers who loved all of these people and who are grieving right now. And we are, all of us, I think, everybody in BC, grieving with them. I wanted to note that we continue to monitor hospitalizations in BC. And just with respect to base beds, and this doesn't include the surge beds that we have in place in BC, the number of base beds that are currently vacant has increased since April 21st from 719 to 912 across the hospital system. And the number of critical care beds that are vacant has increased from 95 to 131. This will move around, but it reflects some of the actions that are just starting we've taken to ensure that our healthcare workers have the support they need and that we ensure that our hospitals are safe to everyone. But I want to emphasize that if you need to go to hospital, it is open and available for you. If you need to go to an emergency room, it is open and available for you. And the number of vacant beds has increased over the last number of days, and we're obviously monitoring that every day, multiple times a day, to ensure that our system is there for everyone and safe for everybody. I want to note that we've received in BC to date of the Pfizer vaccine 1,164,930 doses. We've administered 1,124,468 doses. That's 97%. We're down to effectively, at the end of yesterday, to 40,000 doses. We're expecting the next supply of Pfizer, which this week will be 138,060, to be available to us starting tomorrow. With respect to Moderna, we have received 354,800 doses and administered 309,485 doses. We aren't expecting any Moderna until the end of the week, when we expect to receive 82,300 doses. There's no further date for new doses of Moderna, although we were informed this morning by the federal government that more would be coming in the month of May. With respect to AstraZeneca, and our AstraZeneca numbers are a little behind in terms of administered doses because they've been distributed, 188,000 of them have been distributed through our pharmacy system. We've received 314,700 doses. As of Sunday night, we'd administered 201,419 of those doses. And we're not expecting any new doses this week, and we're expecting to work our way through the supply we have at hand over the coming week, both in health authority-sponsored clinics and in those 640 pharmacy locations across BC. I want to thank everyone and encourage anyone who hasn't registered for the vaccine to register in BC. 1,711,187 people have registered, so you're in good company. And it's important to register because that will, once you register, you will be available the first opportunity when you're contacted to book a vaccine appointment, and that's a significant response. And the system that was put in place at the beginning of April is user-friendly. It's been very effective for people, and we appreciate that all the people have been using it. And I think what this illustrates, last week more than 250,000 doses of vaccine administered and 138,000 arrived, that we have significant capacity and even greater capacity than that to administer the doses that come. The sole limitation that we have in delivering doses of COVID-19 vaccine is the supply of vaccine. And I know the federal government is working very hard to continue to seek opportunities to procure more vaccine. And we're optimistic, and we know that that amount in any event will increase in the month of May, when our weekly supply for the following 4 weeks, starting next week, the beginning of May, is 276,000 doses of Pfizer a week. That'll be an additional amount, and we are ready and able to administer that to people across British Columbia. I want to say finally that just really simple, that we must continue to use our skills, follow the guidance, and adhere to public health orders. It's clear we can do this. In doing this, we must reduce hospitalizations, decrease the pressure on our health care system, and halt the postponement, reverse the postponement of more scheduled surgeries. And it's clear that we must ease the unsustainable mental and physical toll the third wave is taking on the people who take care of us. As you know, this week, we had news that a nurse had passed away from COVID-19, and we think of her. I know everyone in healthcare is thinking of her today. We've made significant and life savings differences in our BC pandemic. Right now, 36%, 35.96 to be exact, of those eligible have received their first shot. And whether we've had our first shot or soon will, it's clear we must still make the difference we need to make in stopping the spread. We must stay in our BC fight against COVID-19 and ensure that when we travel, it's only for essential reasons until the end of the May long weekend. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 23 et 24 avril, celle du 24 et 25 avril et celle du 25 jusqu'au 26 avril en mi-journée. Il y a eu 17 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Pour la première période de référence, nous avons eu 881 nouveaux cas. Pour la deuxième période de référence, nous avons eu 847 nouveaux cas. Au cours des dernières 24 heures, 763 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 484 personnes sont actuellement hospitalisées, dont 158 en soins intensifs. Et bien entendu, nous offrons nos condoléances aux familles et aux amis des 1571 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, Binder Sajan, CTV.
Hi there. I'm just wondering if you have an update on the Johnson & Johnson vaccine, and if you could tell us, if BC has a number yet in terms of how many doses may be arriving and who might be up for getting that shot.
Sure, yeah. So that is also something we learned early this morning, that we are expecting, Canada is expecting to receive 1 shipment, about 300,000 doses approximately, into the National Operations Centre this week. Sometime this week. We still don't have dates for sure, but it needs to be thawed and relabeled, and that we should expect to receive it next week. So we don't have dates yet, but we are looking at hopefully sometime next week. And yes, we have some plans. We're working through those, and we'll let people know when we finalize them. But this is a single dose vaccine, so that makes and it's fridge stable once it's been thawed and repackaged and shipped to us. So that gives us some flexibility in targeting certain populations, particularly people who it may be challenging to find for dose 2. So I'll let you. So that's what we're looking at right now. And the team is coming up with some recommendations that we'll be making public as soon as we're finalized and make those decisions.
Binder, do you have a follow-up?
I do. I just wanted to ask you also about, we were talking about everyone who wants one will be on track to receive a dose of vaccine in BC by July 1st. So I'm just wondering, we're hearing that tomorrow President Biden will be announcing perhaps new changes to CDC guidelines. And what do you want people here to keep in mind until they're able to receive a second dose in terms of, both their level of immunity and potentially visiting with others this summer, people who may have also only had 1 dose?
Yeah, so I think we are learning a lot, mostly from the UK, who have a very similar program to ours in that they've extended the interval for dose 2, that there are a lot of things that we can look forward to after a certain period of time with a certain number of people, so that the critical mass of people being at least 21 days after dose 1. So think about that in terms of our time period. We are hopeful if we get the vaccine that we've been promised, particularly the increased amount of Pfizer that we're due to receive next week, that we have increasing confidence is going to come, that we might be even ahead of that timeline. But be that as it may, right now we have a lot of virus that's still transmitting in our community. If we look at the United States, it's a good example where they have a lot of transmission, and when you reach the certain critical mass of people, you start to see transmissions decreasing, with the exception of some hotspots. We've seen the same thing happen in Israel, where they had very high rates of immunization plus transmission, and then when you reach a certain level, it starts to fall off. We're seeing the same in the UK. So those are the things that are the real world experience that we're looking at to understand what might happen here. Right now, and we've seen this as well across the country, to protect people during this period of time where we still have a lot of circulating virus and not everybody who needs it has had a vaccine, we all need to pay attention to what we're doing to stop transmission. And that means our COVID safety plans in our workplace, working from home if possible, keeping our groups small, not having those social interactions where we're seeing transmission take off to larger numbers of people. Those are all the things we need to do now. But when we look forward to the summer, as we get more and more people protected, we're going to take that pressure off our hospital system. We know from data I talked about from the UK that both Pfizer and the AstraZeneca vaccines that are used extensively there, we're in the high 80s in terms of protection, both vaccines in terms of protection against hospitalization. So those are things that we're watching, and there's no reason to believe that it would be different here. So we need to be patient and to stick with the program for the next few weeks until we get enough people protected that we can, again, take that pressure off the hospital system. And then we can manage with our public health resources, doing the things that we've done, preventing outbreaks, managing outbreaks when they happen, keeping them from being transmitting to larger numbers of people and breaking those chains of transmission. So we're not there yet, but there's a lot of possibilities for what we can see later in the summer.
Next question, Susan Lazarek, Vancouver Sun.
Hi, thanks for taking my question. I had a question about the messaging that goes out to individuals who are in their late 50s now and early 60s, and they're on the age-based vaccine rollout. Is it your right now we're being told we must take the first vaccine that's offered to us, but when those people are waiting for the age-based rollout, if they wait for that, then they're freeing it up for the younger people. Is that part of the messaging that you'd like to get out, or are we still being told no matter what your age, take the first vaccine that's offered to you?
I'm not sure exactly what you're asking, but yes, if you are registered and your age comes up and you're said it's your chance to book, go and get your vaccine. We have, your deferring is not going to make it, not going to allow us getting to that protection for everybody any sooner. So there is enough vaccine coming in the next few weeks for everybody, every adult, between now and essentially the middle of June, the end of June. So when your time comes up, go get your vaccine. And as we go through and cycle through the age groups, more and more vaccine will become available, and we'll go down the age categories quickly. Deferring your own vaccine for another date is not going to get us there any faster, because all of us need to be immunized, and you need to do it yourself to make sure that you're protecting yourself and those around you. Where we've had the vaccine available for younger people, and that's why we've targeted at younger people who may have to wait longer for the age-based program, is the AstraZeneca vaccine. And in BC, we made the decision to make it available through pharmacies primarily, but in some of our high-risk communities, to that age group that we were seeing being hospitalized right now, and that's 40 to 59, and that's why we started with that group. But as we get more supply, perhaps, maybe, and we look at the supplies that we still have in the province, we will look at decreasing the age group of availability for AstraZeneca. So that's the parallel program. But there's no reason to put it off or to think that you can defer it to somebody else. We all need to be immunized. So when your age comes up, when you're offered an appointment to book, go and get your vaccine.
Susan, do you have a follow-up?
Another question I have is about the number of cases of the B1617, and how many of those that you know of already in BC are from community transmission, and how is that happening? Have you been able to pinpoint where they came from?
Yeah, so I talked about that a little bit today as well. These are people who are infected with the virus, and we treat every single one as if they are one of the more transmissible virus variants. The time it takes to do a screening test and then to do whole genome sequencing to identify the virus specifically is as long as a week and sometimes longer, and it has changed over the period of time. So we do know that there's been somewhere around 40-some people who have had COVID-19 that turns out to be one of these variants from the UK. When we link that data back with the public health follow-up that's done at the time that somebody's diagnosed, there's been a small proportion of them that we can say definitely came from international travel, primarily from India, but also from other places. So this strain of the virus is not only seen in India. And then there's a number of them where we cannot link it directly to, the vast majority of them have been linked to cases in the community. So it's not that easy to say exactly which variant is associated with which case investigation, because the case investigation happens at the time and we don't know until sometimes weeks later whether it's a variant or not. That's why we have gone to the weekly reporting of the proportion of our cases that are variants and looking for specific ones that may be of more concern. But the public health approach to every single case is assuming that they have these characteristics that we've associated with the variants of concern, which is increased transmissibility, and which is the most important one. And we are monitoring very carefully to make sure that there's no vaccine breakthrough associated with any specific variant.
Next question, Richard Zussman, Global News.
In Fraser Health over the last week, 32 businesses closed because of exposures. Do you believe some of these exposures could have been prevented if there was a more comprehensive sick day program in British Columbia? And is that something you believe the province should put resources towards?
Yeah, so those these businesses are closed when public health understands that there is transmission in the workplace. So it's not just an exposure; there's transmission between workers in the workplace. And so what it really speaks to is the COVID safety plans and the history that we've had of when you have 1 or 2 or 3 cases in the workplace. Those can lead to more and more chains of transmission if we don't separate people, isolate people, shut the place down, and make sure that the COVID safety plans are revamped and support the business in ensuring that happens. So that's what we've been doing. We also are targeting, and when we can, immunization to those places where we've seen outbreaks happen in those workplaces. And it is an important part of the workplace program to make sure that workers are able to stay home when they're sick. And that's an ongoing discussion that I know government is having with industry. I know there's the federal program to support this, but I don't know, Minister, if you want to speak to that.
Yeah, Richard, you know that this is something that the Premier's been advocating for on the national level and had some success, but there are significant gaps in the program created by the federal government. We've taken a number of actions to protect workers from losing their jobs. Last week passed legislation with respect to time off for vaccination, and the Labour Minister, as you'll be aware, the Finance Minister, the Premier, are working hard on this issue right now.
Richard, do you have a follow-up?
I do. 2 odds and ends here. I'm just wondering, Dr. Henry, if you're at all concerned about Playland opening up on the weekend. There's been some concern expressed about potential spread when people are screaming or yelling on the rides. Are you concerned about Playland? And also, is British Columbia considering vaccination for pregnant women as a priority? I know other provinces are doing this, and BC has so far not made that one of the priorities.
I think everybody who's pregnant, when your vaccine time comes up, it absolutely is something that you should do, and we do encourage that. And yes, we are looking at the data in British Columbia. We do know that there's an increased risk compared to other non-pregnant, age-matched people in British Columbia, as we're seeing in other parts of the province. And we are working through that with our immunization committee and Dr. Money, who's been leading one of the studies across the country around the impacts of COVID in pregnancy. So an important discussion that is ongoing. We know that the risk in younger people is still incrementally less than those by age and certain other conditions. So that is one of the factors that we need to take into account as well. But I encourage, and we know now, I know at the beginning there was some concern about whether people who are pregnant should be receiving the vaccines. There's lots of good data now that supports they are safe and effective in pregnancy, and just last week we had a study that showed that protective antibodies are transmitted through breast milk to the infant as well. So I encourage all pregnant women to be immunized. We know that healthcare workers and others who are in those higher risk groups have been offered immunization, and they should take it up as soon as it's available to them. And we'll be looking at the data specifically from BC in the coming days. In terms of Playland, I know that's something Vancouver Coastal Public Health are working with Playland to understand risks and benefits at this time, and we'll be working with them over the next week.
Next question, Justine Hunter, Globe and Mail.
Thank you. I'm just wondering if you can talk a little bit more about the issue with people dying at home with COVID. I know you said it was a very small number investigated by the coroner that turned out to be related to COVID. But can you give us a bit more sense of detail around that?
Some of these people, of course, we've reported on early on. We had some tragic instances of some younger people who died at home. In the last report I got from the coroner, we're talking about 38 cases in the period from March to March, all of which would have been included in our reports on deaths and the death reports. But the concern was expressed in Ontario that they were starting to see increased cases with the rapid increase in numbers of people infected, that people were not accessing care soon enough. And I know there was a tragic report in the Globe and Mail about a 13-year-old girl. So this is something that we've been working with our coroner service here in BC from the beginning, from last year, to make sure that we did assess this, and if we started to see concerns, we could follow up with people more closely, make sure that people who needed care got it. So far, we're not seeing that happen here, but we will continue to pay attention. And I know my public health teams across the province, the people who do the case contact and the follow-up with cases every day, are very aware of this and making sure that people know that they can get care. They can call 911. The paramedics know what to do to help them, and the hospitals are there for them too.
Justine, do you have a follow-up?
I do. Thank you for that. The other one is just around the vaccine supply that's coming in. You've given us some numbers around how much we're expecting in. The government website says there's 3 priority groups. There's the general population, there's the priority neighborhoods, and then there's the pharmacies. I'm wondering if you can give me a sense of the distribution of incoming supply to those different priority groups. And the priority worker plan seems to be effectively stalled. I don't know if there's any thought to reviving that, or whether it just stays in these 3 main groups that are listed now.
Yeah, so I wouldn't have put them in those groups. I'm not sure what you're referring to be honest, but we do have the main base of our program, where the majority of the vaccine goes to, is the age-based program, and we're moving through that, as you know, as quickly as we can. We have, from the very beginning, identified communities where it doesn't make sense to go back multiple times, so smaller communities, ones that take logistically challenged to get to, etc. So we've done quite a few communities that way, and we've targeted communities where there's high risk of transmission. And we've changed that a little bit as the program has evolved and as our third wave started and transmission has changed. So over the last couple of weeks, we've been looking at communities where there's high rates of transmission and lower rates of immunization. And that could be for a variety of reasons. Could be because it's a younger age population in that community. It could be because people in the who are eligible in their 70s, for example, aren't accessing vaccine, or we're not making it available in a way that is accessible to them. So we've been doing a lot of work with our teams in every health authority to identify what are the issues that make it a challenge for people, what are the barriers for people to be immunized. And we know that for some of those communities, the 13 highest risk communities where we had the least immunization, we identified those last week, and we targeted starting with the AstraZeneca clinics in those communities at a younger age group. And we're looking at, we know that many of these communities are racialized communities, people who may not be comfortable with information that we're putting out from government, that we need to engage with community leaders to get people immunized. And Fraser Health is doing some amazing work in some of these communities, and we'll be doing more in the next little while. So we will continue to target now, given that where we're seeing transmission rates, and if we look at some of the communities that we're talking about in Surrey, for example, many of the people who live in those communities work in our grocery stores, work in our healthcare system, and we need to find ways to support them to be immunized as quickly as possible. And we are continuing our worker program, and we had a list of workers that we were hoping to get through in April, given what we, at the time, thought our supply, particularly of the AstraZeneca vaccine. As you know, we've had challenges with the safety signal with the AstraZeneca vaccine, meaning we had to change that program, and we've had issues now about the age that we can offer it to. So we have continued, and we focused on first responders, school staff, and childcare staff. And again, because of lack of vaccine supplies, we've had to do that in a phased approach, starting with the highest risk communities. So, for example, Surrey got immunized, the fire services, the school staff in Surrey, childcare in Surrey started before some of the other areas in Fraser Health. So that continues, and will continue. This week is a very stretched week in terms of amount of vaccine, but starting next week, once again, we'll be able to open that up more rapidly. But all first responders, school staff, and childcare staff will be immunized in the next few weeks.
Next question, Marcella Bernardo, News 1130.
Hi, Dr. Henry. I wanted to start off by asking what more you can share about the first death, I believe, of a nurse in BC from COVID-19. This was Diana Law, who's 57 years old, and we've spoken with her husband. So just hoping that there's more that you can tell us about what her situation was.
Yeah, so the short answer is no. Those are personal information, and the family opts to share that. That is their prerogative, but it's not incumbent on me to share personal health information that the family owns and is part of. All I can say is that it is, as far as we know, the first nurse who was affected and died from COVID, and it is a tragedy. It is something that affects all of us in the healthcare system when one of our own passes away.
Marcella, do you have a follow-up?
I do, and it's kind of following up what Richard asked about Playland, because in the light of the 13-year-old girl dying in Ontario,
Do you have concerns about Playland being allowed to open when other places are not? And what kind of message does that send out about staying local if children are going to be encouraged to go to Playland if they may or may not live close to Playland?
Yeah, well, certainly that is an issue. We do not want people traveling to Playland, traveling to any other place for recreation or vacation right now, and that I've made very, very clear. I know that Vancouver Coastal Public Health is working with Playland to understand what the plans are. We do know that outside is safer than inside, but as you say, we're at a very challenging time right now in this pandemic, and this is not the time that we want to see people coming together and for recreational reasons.
Next question, Cindy Harnett, Times Colonist.
Thanks for taking my question. There are people with stage 4 cancer undergoing chemo, and they're advocating to get their second shot within 3 weeks, citing research about waning effectiveness for clinically extremely vulnerable people, and them in particular. So I know CEV people many have received their first doses, but will BC be considering a second shot earlier for these people on the heels of Ontario and Alberta?
Yeah, the short answer is we have looked at this in some detail, and we have a very strong team of clinicians that have been working with us, and I want to express my thanks to them publicly under Dr. Maureen O'Donnell at the Provincial Health Services Authority, and this is an important consideration. We also, and if you look at the information from the National Advisory Committee on Immunization, looked at this specifically as well. So there are a couple of important things that we need to remember. There are a whole variety of groups of people who don't or may not amount as much of an antibody response to the first dose of vaccine. And some of them have been studied, including a very small study, as you mentioned, that was done in the UK of people with certain cancers. But there's a whole group of people that have not yet been studied who may also have a similar antibody response. And I say antibody response because we do not yet know what we call the correlates of protection. How much antibody do you actually need to be protected from infection, from severe disease, from hospitalization? So there's a lot of unknowns there, and we don't yet know if it makes a difference for somebody to receive that second dose at 21 weeks or 21 days or 28 days or at 6 months or 4 months or 3 months. So just because one small study has shown that certain group of people have not yet or did not mount an antibody response, it does not take away the basic premise of the program. And so at the moment, no, the best protection for everybody is for more people to be immunized, to have that higher level of protection from a single dose and reduce the risk in our communities by reducing the amount of virus that's circulating in our community. So we are sticking with our it's likely to be less than 4 months given the rate that we're going right now in terms of immunization, and we will provide everybody with their second dose and as quickly as we possibly can. But it's the best protection for everyone, even people who don't mount an initial strong immune response, that everybody get protected with their first dose. So that is the advice that I've received from our experts and from the National Advisory Committee on Immunization, and that's what we'll be working through here in BC for now.
Cindy, do you have a follow-up? Oh.
That one of the important caveats around that is there are some individuals who their treatments need to be moved around depending on their immunization when they get their first dose and when they're eligible for their second dose, depending on certain types of treatment, and those are being handled on a one-of case-by-case basis. And the other really important thing is that we are monitoring vaccine effectiveness in every single person, which is why I say this over and over again, why I'm so concerned about making sure that we get everybody's information about what dose they received when into our clinical system so that we can monitor that. And the BC CDC is doing that and will continue to do that. So if we start to see breakthrough infections or that the vaccine effectiveness is waning in certain populations, we can change our strategy. But we've not seen that yet. We've not seen any indication of that. So we're confident right now that the best protection for all of us, including people who are immune compromised, is to get everybody with their first dose of vaccine as soon as possible.
Cindy, do you have a follow-up?
I do, thank you. So the numbers, the daily case counts today, is there anything more that you can say about the effectiveness of the no indoor gathering restrictions based on today's numbers? And I just wanted to clarify, is the death in long-term care where there's an outbreak, was that Victoria, please?
No, it wasn't in Victoria. It was in the Interior Health Region. So there's, unfortunately, it's hard to correlate exact numbers to the measures. I can tell you that our numbers and the numbers of contacts that each case is having, that's another thing that we follow in public health. And we were seeing cases have large numbers of people that they had close contact with at the time they were infectious. And since we have put in the suite of measures that we did a number of weeks ago, and increasingly people have decreased the number of social contacts they've had, no matter what context that was in. We are still seeing that transmission is primarily related to social connections in people's homes, where they have groups of people over, when they're meeting with groups of people indoors. And that remains a challenge. Even if it is smaller numbers now, that is still where we're seeing most cases. So yes, we've seen some impact of the measures that were put in place, and that's important. But I need to remind people that the indoor settings, when you have people over, even with the best of intentions, those are risky settings right now. And we're bringing things home to our family, to our household, and it's being transmitted to everybody in the household. That is the impact we're seeing from the strains of virus that are circulating right now. They are more transmissible. So when before, if somebody got sick from a contact they had at work and came home to their family, there might have been one or two other people in the family that caught it. But now we're seeing everybody get it. So that is why it is so important for everybody to pay attention right now. And I hear from my colleagues in the ICU, and I've said this a number of times, that they have whole families who are admitted to hospital, and an aunt needs to take care of the children because the parents are in hospital right now. We've had tragic cases where two husband and wife are in the ICU together. And that is what we need to stop right now. And that's why it's so important to review those safety plans in the workplace so that you're not giving opportunities for the virus to transmit, and to step back from those social interactions, particularly indoors.
Next question, Daksh Panwar, Red FM.
Hi, Dr. Henry. Over the weekend, we have seen reports from Israel that there have been cases of heart inflammation among people who have received the Pfizer vaccine. We have inoculated a fair few number over here in British Columbia with the Pfizer vaccine. Have we seen any such cases?
I'm sorry, I missed the first part. We've seen cases of what in Israel?
Heart inflammation in Israel because of the Pfizer vaccine.
Okay. I'm not aware of heart conditions linked to the Pfizer vaccine. I was on a call with Israel last weekend, so it was not something that's come up. It's not something that we've seen as an adverse event following immunization. We have a very strong, we call it pharmacovigilance program in BC and across Canada, where we monitor adverse events following immunization. So when you immunize over 1.5 million people, there are many things that can happen to that person. Some of them will be related to vaccine, and some of them are just would have happened anyway in that time frame, whether it's a stroke or a heart attack or other conditions. We have detected the safety signal, as we've talked about, with this rare form of blood clots with one of the vaccines. And so that gives me confidence that our system would pick up if there was something that was associated with the vaccine itself. But we've not had any cases of directly related to vaccine of heart conditions that I'm aware of. But I will certainly go back and check and look up what they're talking about from Israel, because I'm not quite sure what it is.
Dax, do you have a follow-up?
Yes, I do. Dr. Henry, have there been any adverse events in people who have been vaccinated so far in BC?
Yes, we have. We call them AFEs, the adverse events following immunization, and we report on those. They're on the BC CDC website weekly. I was reporting some of them, but primarily the biggest one that we see the most frequently is an allergic reaction right after the vaccine's delivered, and we've seen that with all three of the vaccines that we've had that we have available in BC. None of them have been fatal. We've had no deaths associated with the vaccine, even though there have been people who have died in the period of time of weeks after they've received vaccine. But none of them have been caused by the vaccine. But the more detailed information is on the BC CDC website, and I encourage people to have a look at that.
And we have time for one more question. For everybody listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For the last question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, of the 17 people who died over the weekend, most were over the age of 70. Can you elaborate on why we're still seeing these high numbers, aside from lag time? Because it's been at least a month since the majority of that age group was vaccinated. So you said in the past it's likely many might have had COVID prior to the vaccines, but do we know how many that was the case for with these deaths over the weekend? How many didn't take the vaccine perhaps, and how many did the vaccine maybe not work?
So we have been following breakthrough disease after immunization, and there have been a small number. I reported the stats from a week ago. We're up to about less than 1%, so 0.9%, I think it was the last time we looked. So that translates into about 1,000 people who got COVID after 14 days after their initial dose 1, and a much smaller number that have got COVID after dose 2, 7 days after dose 2. So that's an overestimate, because some people may have been incubating in that 14-day period, and that's when they tested positive. There have been a small number of deaths in those people, and I don't have that by individuals from this past weekend, and so I don't actually have the immunization status of the people from this weekend. It takes time to link those up. But I can say that the death associated with independent living facility in the interior was a person who was not vaccinated, and that most of the cases that we've seen, and in long-term care in particular, have been people who've been vaccinated have had very mild illness.
Tanya, do you have a follow-up?
Yes, and if we could please get an answer in French from Minister Dix as well. It's been almost a month since restrictions in long-term care homes were eased. So what's the overall situation right now? I know broadly it's improved among the elderly population thanks to the vaccines, but how much is the virus still transmitting in care homes, and how is that transition happening?
Yeah, so we are reporting. We still have the ongoing monitoring that we've been doing all along, and the outbreak response. So public health, and it responds to every single case in a staff person or a resident of a long-term care home. And we have had a few outbreaks, as I mentioned, but they have been limited. And we do the same protocols that we have been doing all along. So if a staff person or a resident tests positive, then the whole facility is tested and monitored to see if other people get the vaccine, or get the illness as well, the virus as well, if it's being transmitted. So what we are seeing is that with the high rates of protection in residents in particular, we're not seeing those ongoing protracted outbreaks. We are seeing low-level transmission, and that most of the disease is mild, but not always. So the risk has gone down dramatically in care homes, and I think that's really an incredibly positive thing and hopeful for the rest of us for once we get high rates of immunization. The other thing, of course, that we've seen is there have been cases in staff members, and we encourage healthcare workers across the board to receive their vaccine and remind them that this is important.
Et on a vu un effet profond de la vaccination des résidents et ceux qui travaillent dans le secteur sur le nombre d'éclosions dans les centres de soins partout dans la province. Vous vous souvenez du fait que le 15 janvier, il y avait 49 éclosions un peu partout dans la province. Cela est arrivé à 2 il y a quelques-uns maintenant. Dans la province. Donc, ça, c'est la première chose. La deuxième chose qui est essentielle, je pense, c'est que le fait qu'il y a des visites dans les centres de soins est très important pour la santé de tout le monde, la santé des familles, bien entendu, mais surtout la santé de ceux qui habitent dans les centres de soins et pour les gens qui y travaillent. Je pense que le changement qu'on a vu depuis un mois, c'est un changement de qualité de vie importante. Donc, on a toujours une grande protection des gens dans les centres de soins. On a la grande majorité, c'est-à-dire en dehors de 90%, des gens qui sont vaccinés, que ce soit des résidents, des gens qui vivent là-bas ou des gens qui travaillent. Je pense que l'effet de cela est profond, à la fois pour la santé et pour la bataille contre le COVID-19 dans la province, bien entendu, mais surtout pour la qualité de vie de tout le monde qui vit dans nos centres de soins, et je m'en ravis. Je m'en réjouis de toute façon. Et merci beaucoup. Thank you very much, and we'll see you on Thursday.